Section 29 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4 by Henry Gray. Trigeminal Nerve, Part 2. Branches of distribution. These are divisible into four groups, viz., orbital, palatine, posterior superior nasal, and pharyngeal. The orbital branches, rami orbitalis, ascending branches, are 2 or 3 delicate filaments which enter the orbit by the inferior orbital fissure, and supply the periosteum. According to Luschka, some filaments pass through foramina in the frontoethmoidal suture to supply the mucous membrane of the posterior ethmoidal and sphenoidal sinuses. The palatine nerves, nervus palatini, descending branches, are distributed to the roof of the mouth, soft palate, tonsil, and lining membrane of the nasal cavity. Most of their fibers are derived from the sphenopalatine branches of the maxillary nerve. They are 3 in number, anterior, middle, and posterior. The anterior palatine nerve, nervus palatinus anterior, descends through the pterygopalatine canal, emerges upon the hard palate through the greater palatine foramen, and passes forward in a groove in the hard palate, nearly as far as the incisor teeth. It supplies the gums, the mucous membrane, and glands of the hard palate, and communicates in front with the terminal filaments of the nasopalatine nerve. While in the pterygopalatine canal, it gives off posterior inferior nasal branches, which enter the nasal cavity through openings in the palatine bone, and ramify over the inferior nasal concha and middle and inferior meatarses at its exit from the canal. A palatine branch is distributed to both surfaces of the soft palate. The middle palatine nerve, nervus palatinus medius, emerges through one of the minor palatine canals and distributes branches to the uvula, tonsil, and soft palate. It is occasionally wanting. The posterior palatine nerve, nervus palatinus posterior, descends through the pterygopalatine canal and emerges by a separate opening behind the greater palatine foramen. It supplies the soft palate, tonsil, and uvula. The middle and posterior palatine join with the tonsillar branches of the Glossopharyngeal to form a plexus, circulus tonsillaris, around the tonsil. The posterior superior nasal branches, rami nasalis posteriores superiores, are distributed to the septum and lateral wall of the nasal fossa. They enter the posterior part of the nasal cavity by the sphenopalatine foramen and supply the mucous membrane covering the superior and middle nasal conchae, the lining of the posterior ethmoidal cells, and the posterior part of the septum. One branch, longer and larger than the others, is named the nasopalatine nerve. It enters the nasal cavity through the sphenopalatine foramen, passes across the roof of the nasal cavity below the orifice of the sphenoidal sinus to reach the septum, and then runs obliquely downward and forward between the periosteum and mucous membrane of the lower part of the septum. It descends to the roof of the mouth through the incisive canal and communicates with the corresponding nerve of the opposite side and with the anterior palatine nerve. It furnishes a few filaments to the mucous membrane of the nasal septum. The pharyngeal nerve, pterygopalatine nerve, is a small branch arising from the posterior part of the ganglion. It passes through the pharyngeal canal with the pharyngeal branch of the internal maxillary artery, and is distributed to the mucous membrane of the nasal part of the pharynx, behind the auditory tube. The pharyngeal nerve, pterygopalatine nerve, is a small branch arising from the posterior part of the ganglion. It passes through the pharyngeal canal with the pharyngeal branch of the internal maxillary artery, and is distributed to the mucous membrane of the nasal part of the pharynx, behind the auditory tube. The mandibular nerve, nervus mandibularis, inferior maxillary nerve, supplies the teeth and gums of the mandible, the skin of the temporal region, the auricula, the lower lip, the lower part of the face, and the muscles of mastication. It also supplies the mucous membrane of the anterior 2/3 of the tongue. It is the largest of the 3 divisions of the fifth, and is made up of 2 roots, a large sensory root proceeding from the inferior angle of the semilunar ganglion, and a small motor root, the motor part of the trigeminal, which passes beneath the ganglion and unites with the sensory root just after its exit through the foramen ovale. Immediately beneath the base of the skull, the nerve gives off from its medial side a recurrent branch, nervus spinosus, and the nerve to the pterygoides internus, and then divides into two trunks, an anterior and a posterior. The nervus spinosus, recurrent or meningeal branch, enters the skull through the foramen spinosum with the middle meningeal artery. It divides into two branches, anterior and posterior, which accompany the main divisions of the artery and supply the dura mater. The posterior branch also supplies the mucous lining of the mastoid cells. The anterior communicates with the meningeal branch of the maxillary nerve. The internal pterygoid nerve, nervus pterygoideus internus. The nerve to the pterygoideus internus is a slender branch, which enters the deep surface of the muscle. It gives off one or two filaments to the otic ganglion. The anterior and smaller division of the mandibular nerve receives nearly the whole of the fibres of the motor root of the nerve, and supplies the muscles of mastication and the skin and mucous membrane of the cheek. Its branches are the mesenteric, deep temporal buccinator, and external pterygoid. The mesenteric nerve, nervus mesentericus, passes lateralward above the pterygoideus externus, in front of the temporomandibular articulation, and behind the tendon of the temporalis. It crosses the mandibular notch with the mesenteric artery to the deep surface of the masseter, in which it ramifies nearly as far as its anterior border. It gives a filament to the temporomandibular joint. The deep temporal nerves, nervus temporales profundi, are two in number, anterior and posterior. They pass above the upper border of the pterygoideus externus and enter the deep surface of the temporalis. The posterior branch, of small size, is placed at the back of the temporal fossa, and sometimes arises in common with the mesenteric nerve. The anterior branch is frequently given off from the buccinator nerve, and then turns upward over the upper head of the pterygoideus externus. Frequently a third or intermediate branch is present. The buccinator nerve, nervus buccinatorus, long buccal nerve, passes forward between the two heads of the pterygoideus externus and downward beneath or through the lower part of the temporalis. It emerges from under the anterior border of the masseter, ramifies on the surface of the buccinator, and unites with the buccal branches of the facial nerve. It supplies a branch to the pterygoideus externus during its passage through that muscle, and may give off the anterior deep temporal nerve. The buccinator nerve supplies the skin over the buccinator, and the mucous membrane lining its inner surface. External pterygoid nerve, nervus pterygoideus externus. The nerve to the pterygoideus externus frequently arises in conjunction with the buccinator nerve, but it may be given off separately from the anterior division of the mandibular nerve. It enters the deep surface of the muscle. The posterior and larger division of the mandibular nerve is for the most part sensory, but receives a few filaments from the motor root. It divides into auriculotemporal, lingual, and inferior alveolar nerves. The auriculotemporal nerve, nervus auriculotemporalis, generally arises by two roots, between which the middle meningeal artery ascends. It runs backward beneath the pterygoideus externus to the medial side of the neck of the mandible. It then turns upward with the superficial temporal artery, between the auricular and condyle of the mandible, under cover of the parotid gland. Escaping from beneath the gland, it ascends over the zygomatic arch, and divides into superficial temporal branches. The branches of communication of the auriculotemporal nerve are with the facial nerve and with the otic ganglion. The branches to the facial, usually two in number, pass forward from behind the neck of the mandible and join the facial nerve at the posterior border of the masseter. The filaments to the otic ganglion are derived from the roots of the auriculotemporal nerve close to their origin. Its branches of distribution are anterior auricular, branches to the external acoustic meatus, superficial temporal, articular, parotid. The anterior auricular branches, nervus auricularis anteriores, are usually two in number. They supply the front of the upper part of the auricula, being distributed principally to the skin covering the front of the helix and tragus. The branches to the external acoustic meatus, nervus meatus auditorii externi, 2 in number, enter the meatus between its bony and cartilaginous portions and supply the skin lining it. The upper one sends a filament to the tympanic membrane. The articular branches consist of 1 or 2 twigs which enter the posterior part of the temporomandibular joint. The parotid branches, rami parotidae, supply the parotid gland. The superficial temporal branches, rami temporales superficiales, accompany the superficial temporal artery to the vertex of the skull. They supply the skin of the temporal region and communicate with the facial and zygomatic temporal nerves. The lingual nerve, nervus lingualis, supplies the mucous membrane of the anterior 2/3 of the tongue. It lies at first beneath the pterygoideus externus, medial to and in front of the inferior alveolar nerve, and is occasionally joined to this nerve by a branch which may cross the internal maxillary artery. The chorda tympani also joins it at an acute angle in this situation. The nerve then passes between the pterygoideus internus and the ramus of the mandible, and crosses obliquely to the side of the tongue over the constrictor pharyngis superior and styloglossus, and then between the hypoglossal and the deep part of the submaxillary gland. Finally, it runs beneath the duct of the submaxillary gland and along the tongue to its tip, lying immediately beneath the mucous membrane. Its branches of communication are with the facial, through the chorda tympani, the inferior alveolar and hypoglossal nerves, and the submaxillary ganglion. The branches to the submaxillary ganglion are 2 or 3 in number. Those connected with the hypoglossal nerve form a plexus at the anterior margin of the hyoglossus. Its branches of distribution supply the sublingual gland, the mucous membrane of the mouth, the gums, and the mucous membrane of the anterior 2/3 of the tongue. The terminal filaments communicate, at the tip of the tongue, with the hypoglossal nerve. The inferior alveolar nerve, nervus alveolaris inferior, inferior dental nerve, is the largest branch of the mandibular nerve. It descends with the inferior alveolar artery, at first beneath the pterygoideus externus, and then between the sphenomandibular ligament and the ramus of the mandible to the mandibular foramen. It then passes forward in the mandibular canal, beneath the teeth, as far as the mental foramen, where it divides into 2 terminal branches, incisive and mental. The branches of the inferior alveolar nerve are the mylohyoid, dental, incisive, and mental. The mylohyoid nerve, nervus mylohyoideus, is derived from the inferior alveolar just before it enters the mandibular foramen. It descends in a groove on the deep surface of the ramus of the mandible, and reaching the undersurface of the mylohyoideus supplies this muscle and the anterior belly of the digastricus. The dental branches supply the molar and premolar teeth. They correspond in number to the roots of those teeth, each nerve entering the orifice at the point of the root, and supplying the pulp of the tooth. Above the alveolar nerve they form an inferior dental plexus. The incisive branch is continued onward within the bone, and supplies the canine and incisor teeth. The mental nerve, nervus mentalis, emerges at the mental foramen, and divides beneath the triangularis muscle into 3 branches. 1 descends to the skin of the chin, and 2 ascend to the skin and mucous membrane of the lower lip. These branches communicate freely with the facial nerve. 2 small ganglia, the otic and the submaxillary, are connected with the mandibular nerve. Otic ganglion, ganglion oticum. The otic ganglion is a small, oval-shaped, flattened ganglion of a reddish-grey colour, situated immediately below the foramen ovale. It lies on the medial surface of the mandibular nerve, and surrounds the origin of the nerve to the pterygoideus internus. It is in relation, laterally, with the trunk of the mandibular nerve at the point where the motor and sensory roots join, medially with the cartilaginous part of the auditory tube, and the origin of the tensor veli palatini, posteriorly with the middle meningeal artery. Branches of communication. It is connected by 2 or 3 short filaments with the nerve to the pterygoideus internus, from which it may obtain a motor and possibly a sensory root. It communicates with the glossopharyngeal and facial nerves through the lesser superficial petrosal nerve continued from the tympanic plexus, and through this nerve it probably receives a root from the glossopharyngeal and a motor root from the facial. Its sympathetic root consists of a filament from the plexus surrounding the middle meningeal artery. The fibres from the glossopharyngeal which pass to the otic ganglion in the small superficial petrosal are supposed to be sympathetic efferent preganglionic fibres from the dorsal nucleus or inferior salivatory nucleus of the medulla. Fibres, postganglionic, From the otic ganglion with which these form synapses are supposed to pass with the auriculotemporal nerve to the parotid gland. A slender filament, sphenoidal, ascends from it to the nerve of the pterygoid canal, and a small branch connects it with the chorda tympani. Its branches of distribution are a filament to the tensor tympani and one to the tensor veli palatini. The former passes backward, lateral to the auditory tube; the latter arises from the ganglion, near the origin of the nerve, to the pterygoideus internus, and is directed forward. The fibres of these nerves are, however, mainly derived from the nerve to the pterygoideus internus. Submaxillary ganglion. Ganglion submaxillare. The submaxillary ganglion is of small size and is fusiform in shape. It is situated above the deep portion of the submaxillary gland on the hyoglossus, near the posterior border of the mylohyodeus, and is connected by filaments with the lower border of the lingual nerve. It is suspended from the lingual nerve by two filaments which join the anterior and posterior parts of the ganglion. Through the posterior of these it receives a branch from the chorda tympani nerve which runs in the sheath of the lingual. These are sympathetic efferent, preganglionic fibres from the facial nucleus or the superior salivatory nucleus of the medulla oblongata that terminates in the submaxillary ganglion. The postganglionic fibres pass to the submaxillary gland. It communicates with the sympathetic by filaments from the sympathetic plexus around the external maxillary artery. Its branches of distribution are 5 or 6 in number. They arise from the lower part of the ganglion, and supply the mucous membrane of the mouth and the duct of the submaxillary gland, some being lost in the submaxillary gland. The branch of communication from the lingual to the forepart of the ganglion is by some regarded as a branch of distribution, through which filaments pass from the ganglion to the lingual nerve, and by it are conveyed to the sublingual gland and the tongue. Trigeminal nerve reflexes. Pains referred to various branches of the trigeminal nerve are of very frequent occurrence, and should always lead to a careful examination in order to discover a local cause. As a general rule, the diffusion of pain over the various branches of the nerve is at first confined to one only of the main divisions, and the search for the causative lesion should always commence with a thorough examination of all those parts which are supplied by that division, although in severe cases pain may radiate over the branches of the other main divisions. The commonest example of this condition is the neuralgia which is so often associated with dental caries. Here, although the tooth itself may not appear to be painful, the most distressing referred pains may be experienced, and these are at once received by treatment directed to the affected tooth. Many other examples of trigeminal reflexes could be quoted, but it will be sufficient to mention the more common ones. Dealing with the ophthalmic nerve, severe supraorbital pain is commonly associated with acute glaucoma or with disease of the frontal or ethmoidal air cells. Malignant growths or empyema of the maxillary antrum, or unhealthy conditions about the inferior conchae or the septum of the nose, are often found giving rise to second division neuralgia, and should be always looked for in the absence of dental disease in the maxilla. It is on the mandibular nerve, however, that some of the most striking reflexes are seen. It is quite common to meet with patients who complain of a pain in the ear, in whom there is no sign of oral disease, and the cause is usually to be found in a carious tooth in the mandible. Moreover, with an ulcer or cancer of the tongue, often the first pain to be experienced is one which radiates to the ear and temporal fossa over the distribution of the auriculotemporal nerve. End of section 29. Section 30 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Abducent nerve, facial nerve. 1F. The abducent nerve, nervus abducens, sixth nerve. The abducent nerve supplies the rectus lateralis oculi. Its fibres arise from a small nucleus situated in the upper part of the rhomboid fossa, close to the middle line and beneath the colliculus facialis. They pass downward and forward through the pons and emerge in the furrow between the lower border of the pons and the upper end of the pyramid of the medulla oblongata. From the nucleus of the sixth nerve, fibres are said to pass through the medial longitudinal fasciculars to the oculomotor nerve of the opposite side, along which they are carried to the rectus medialis. The rectus lateralis of one eye and the rectus medialis of the other may therefore be said to receive their nerves from the same nucleus. The nerve pierces the dura mater on the dorsum sellae of the sphenoid, runs through a notch in the bone below the posterior clinoid process, and passes forward through the cavernous sinus on the lateral side of the internal carotid artery. It enters the orbit through the superior orbital fissure, above the ophthalmic vein, from which it is separated by a lamina of dura mater. It then passes between the two heads of the rectus lateralis, and enters the ocular surface of that muscle. The abducent nerve is joined by several filaments from the carotid and cavernous plexuses, and by one from the ophthalmic nerve. The oculomotor, trochlear, ophthalmic, and abducent nerves bear certain relations to each other in the cavernous sinus, at the superior orbital fissure, and in the cavity of the orbit, as follows. In the cavernous sinus, the oculomotor, trochlear, and ophthalmic nerves are placed in the lateral wall of the sinus, in the order given from above downward. The abducent nerve lies at the lateral side of the internal carotid artery. As these nerves pass forward to the superior orbital fissure, the oculomotor and ophthalmic divide into branches, and the abducent nerve approaches the others, so that their relative positions are considerably changed. In the superior orbital fissure, the trochlear nerve and the frontal and lacrimal divisions of the ophthalmic lie in this order from the medial to the lateral side upon the same plane. They enter the cavity of the orbit above the muscles. The remaining nerves enter the orbit between the two heads of the rectus lateralis. The superior division of the oculomotor is the highest of these. Beneath this lies the nasociliary branch of the ophthalmic, then the inferior division of the oculomotor, and the abducent lowest of all. In the orbit, the trochlear, frontal, and lacrimal nerves lie immediately beneath the periosteum, the trochlear nerve resting on the obliquus superior, the frontal on the levator palpebrae superioris, and the lacrimal on the rectus lateralis. The superior division of the oculomotor nerve lies immediately beneath the rectus superior, while the nasociliary nerve crosses the optic nerve to reach the medial wall of the orbit. Beneath these is the optic nerve, surrounded in front by the ciliary nerves, and having the ciliary ganglion on its lateral side, between it and the rectus lateralis. Below the optic nerve are the inferior division of the oculomotor, and the abducent, the lateral lying on the medial surface of the rectus lateralis. 5g. The facial nerve. Nervus facialis, seventh nerve. The facial nerve consists of a motor and a sensory part, the latter being frequently described under the name of the nervus intermedius, pars intermedii of Bisberg. The two parts emerge at the lower border of the pons in the recess between the olive and the inferior peduncle, the motor part being the more medial. Immediately to the lateral side of the sensory part is the acoustic nerve. The motor part supplies somatic motor fibres to the muscles of the face, scalp, and auricle, the buccinator and the platysma, the stapedius, the stylohyoideus, and posterior belly of the digastricus. It also contains some sympathetic motor fibres which constitute the vasodilator nerves of the submaxillary and sublingual glands, and are conveyed to the chorda tympani nerve. These are preganglionic fibres of the sympathetic system, and terminate in the submaxillary ganglion and small ganglia in the hilus of the submaxillary gland. From these ganglia, postganglionic fibres are conveyed to these glands. The sensory part contains the fibres of taste for the anterior 2/3 of the tongue, and a few somatic sensory fibres from the middle ear region. A few splanchnic sensory fibres are also present. The motor root arises from a nucleus which lies deeply in the reticular formation of the lower part of the pons. The nucleus is situated above the nucleus ambiguus, behind the superior olivary nucleus, and medial to the spinal tract of the trigeminal nerve. From this origin the fibres pursue a curved course in the substance of the pons. They first pass backward and medialward toward the rhomboid fossa, and, reaching the posterior end of the nucleus of the abducent nerve, run upward close to the middle line beneath the colliculus fasciculus. At the anterior end of the nucleus of the abducent nerve they make a second bend, and run downward and forward through the pons to their point of emergence between the olive and the inferior peduncle. The sensory root arises from the genicular ganglion, which is situated on the geniculum of the facial nerve in the facial canal, behind the hiatus of the canal. The cells of this ganglion are unipolar, and the single process divides in a T-shaped manner into central and peripheral branches. The central branches leave the trunk of the facial nerve in the internal acoustic meatus, and form the sensory root. The peripheral branches are continued into the chorda tympani and greater superficial petrosal nerves. Entering the brain at the lower border of the pons between the motor root and the acoustic nerve, the fibres of the sensory root pass into the substance of the medulla oblongata and end in the upper part of the terminal nucleus of the glossopharyngeal nerve and the fasciculus solitarius. From the superficial attachments to the brain, the two roots of the facial nerve pass lateralward and forward with the acoustic nerve to the internal acoustic meatus. In the meatus the motor root lies in the groove on the upper and anterior surface of the acoustic nerve, the sensory root being placed between them. At the bottom of the meatus the facial nerve enters the facial canal, which it traverses to its termination at the stylomastoid foramen. It is at first directed lateralward between the cochlea and vestibule toward the medial wall of the tympanic cavity. It then bends suddenly backward and arches downward behind the tympanic cavity to the stylomastoid foramen. The point where it changes its direction is named the geniculum. It presents a reddish gangliform swelling, the genicular ganglion, ganglion geniculi, geniculate ganglion, nucleus of the sensory root of the nerve. On emerging from the stylomastoid foramen, the facial nerve runs forward in the substance of the parotid gland, crosses the external carotid artery, and divides behind the ramus of the mandible into branches, from which numerous offsets are distributed over the side of the head, face, and upper part of the neck, supplying the superficial muscles in these regions. The branches and their offsets unite to form the parotid plexus. Branches of communication. The branches of communication of the facial nerve may be arranged as follows: in the internal meatus, with the acoustic nerve; at the genicular ganglion, with the sphenopalatine ganglion by the greater superficial petrosal nerve; with the otic ganglion by a branch which joins the lesser superficial petrosal nerve; with the sympathetic on the middle meningeal artery; in the facial canal, with the auricular branch of the vagus; at its exit from the stylomastoid foramen, with the glossopharyngeal, with the vagus, with the great auricular, with the auriculotemporal; behind the ear, with the lesser occipital; on the face, with the trigeminal; in the neck, with the cutaneous cervical. In the internal acoustic meatus some minute filaments pass from the facial to the acoustic nerve. The greater superficial petrosal nerve, large superficial petrosal nerve, arises from the genicular ganglion and consists chiefly of sensory branches which are distributed to the mucous membrane of the soft palate, but it probably contains a few motor fibres which form the motor root of the sphenopalatine ganglion. It passes forward through the hiatus of the facial canal and runs in a sulcus on the anterior surface of the petrous portion of the temporal bone beneath the semilunar ganglion to the foramen lacerum. It receives a twig from the tympanic plexus, and in the foramen is joined by the deep petrosal from the sympathetic plexus on the internal carotid artery to form the nerve of the pterygoid canal, which passes forward through the pterygoid canal and ends in the sphenopalatine ganglion. The genicular ganglion is connected with the otic ganglion by a branch which joins the lesser superficial petrosal nerve, and also with the sympathetic filaments accompanying the middle meningeal artery. According to Arnold, a twig passes back from the ganglion to the acoustic nerve. Just before the facial nerve emerges from the stylomastoid foramen, it generally receives a twig from the auricular branch of the vagus. After its exit from the stylomastoid foramen, the facial nerve sends a twig to the glossopharyngeal, and communicates with the auricular branch of the vagus, with the great auricular nerve of the cervical plexus, with the auriculotemporal nerve in the parotid gland, and with the lesser occipital behind the ear, on the face with the terminal branches of the trigeminal, and in the neck with the cutaneous cervical nerve. Branches of distribution. The branches of distribution of the facial nerve may be thus arranged: with the facial canal, nerve to the stapedius muscle, chorda tympani; at its exit from the stylomastoid foramen, posterior auricular, digastric, stylohyoid. On the face: temporal, zygomatic, buccal, mandibular, cervical. The nerve to the stapedius: nervus stapedius, tympanic branch. Arises opposite the pyramidal eminence. It passes through a small canal in this eminence to reach the muscle. The cauda tympani nerve is given off from the facial as it passes downward behind the tympanic cavity, about 6 mm from the stylomastoid foramen. It runs upward and forward in a canal, and enters the tympanic cavity, through an aperture, iter caudae posterius, on its posterior wall, close to the medial surface of the posterior border of the tympanic membrane, and on a level with the upper end of the manubrium of the malleus. It traverses this tympanic cavity, between the fibrous and mucous layers of the tympanic membrane, crosses the manubrium of the malleus, and emerges from the cavity through a foramen situated at the inner end of the petrotympanic fissure, and named the iter caudae anterius, canal of Hugier. It then descends between the pterygodeus externus and internus on the medial surface of the spina angularis of the sphenoid, which it sometimes grooves and joins at an acute angle the posterior border of the lingual nerve. It receives a few efferent fibres from the motor root. These enter the submaxillary ganglion, and through it are distributed to the submaxillary and sublingual glands. The majority of its fibres are afferent, and are continued onward through the muscular substance of the tongue to the mucous membrane covering its anterior 2/3. They constitute the nerve of taste for this portion of the tongue. Before uniting with the lingual nerve, the cauda tympani is joined by a small branch from the otic ganglion. The posterior auricular nerve, nervus auricularis posterior, arises close to the stylomastoid foramen, and runs upward in front of the mastoid process. Here it is joined by a filament from the auricular branch of the vagus, and communicates with the posterior branch of the great auricular and with the lesser occipital. As it ascends between the external acoustic meatus and mastoid process, it divides into auricular and occipital branches. The auricular branch supplies the auricularis posterior, and the intrinsic muscles on the cranial surface of the auricula. The occipital branch, the larger, passes backward along the superior nuchal line of the occipital bone and supplies the occipitalis. The digastric branch, ramus digastricus, arises close to the stylomastoid foramen and divides into several filaments, which supply the posterior belly of the digastricus. One of these filaments joins the glossopharyngeal nerve. The stylohyoid branch, ramus stylohyoideus, frequently arises in conjunction with the digastric branch. It is long and slender, and enters the stylohyoideus about its middle. The temporal branches, rami temporalis, cross the zygomatic arch to the temporal region, supplying the auricularis anterior and superior, and joining with the zygomatico-temporal branch of the maxillary, and with the auriculo-temporal branch of the mandibular. The more anterior branches supply the frontalis, the orbicularis oculi, and the corrugator, and join the supraorbital and lacrimal branches of the ophthalmic. The zygomatic branches, rami zygomatici, malar branches, run across the zygomatic bone to the lateral angle of the orbit, where they supply the orbicularis oculi, and join with filaments from the lacrimal nerve and the zygomatico-facial branch of the maxillary nerve. The buccal branches, rami buccales, infraorbital branches, of larger size than the rest, pass horizontally forward to be distributed below the orbit and around the mouth. The superficial branches run beneath the skin and above the superficial muscles of the face, which they supply. Some are distributed to the procerus, joining at the medial angle of the orbit with the infratrochlear and nasociliary branches of the ophthalmic. The deep branches pass beneath the zygomaticus and the quadratus labii superioris, supplying them and forming an infraorbital plexus with the infraorbital branch of the maxillary nerve. These branches also supply the small muscles of the nose. The lower deep branches supply the buccinator and orbicularis oris, and join with filaments of the buccinator branch of the mandibular nerve. The mandibular branch, ramus marginalis mandibulae, passes forward beneath the platysma and the triangularis, supplying the muscles of the lower lip and chin, and communicating with the mental branch of the inferior alveolar nerve. The cervical branch, ramus colli, runs forward beneath the platysma, and forms a series of arches across the side of the neck over the suprahyoid region. One branch descends to join the cervical cutaneous nerve from the cervical plexus. Others supply the platysma. End of section 30. Section 31 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit Librivox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4 by Henry Gray. The acoustic nerve, the glossopharyngeal nerve. 5H. The acoustic nerve, 8th nerve. The acoustic nerve consists of two distinct sets of fibres which differ in their peripheral endings, central connections, functions, and time of medullation. It is soft in texture and devoid of neurolemma. Cochlear nerve. The cochlear nerve or root, the nerve of hearing, arises from bipolar cells in the spiral ganglion of the cochlea, situated near the inner edge of the osseous spiral lamina. The peripheral fibres pass to the organ of Corti. The central ones pass down the modiolus and then through the foramina of the tractus spiralis foraminosus, or through the foramen centrale into the lateral or outer end of the internal auditory meatus. The nerve passes along the internal auditory meatus with the vestibular nerve and across the subarachnoid space, just above the flocculus, almost directly medialward toward the inferior peduncle, to terminate in the cochlear nucleus. The cochlear nerve is placed laterally to the vestibular root. Its fibres end in two nuclei. One, the accessory nucleus, lies immediately in front of the inferior peduncle. The other, the tuberculum acousticum, somewhat lateral to it. The stria medullaris, stria acousticae, are the axons of the cells of the tuberculum acousticum. They pass over the inferior peduncle and across the rhomboid fossa to the median sulcus. Here they dip into the substance of the pons, to end around the cells of the superior olivary nuclei of both sides. There are, however, other fibres, and these are both direct and crossed, which passed into the lateral lemniscus. The cells of the accessory nucleus give origin to fibres which run transversely in the pons and constitute the trapezium. Of the trapezoid fibres, some end around the cells of the superior olivary nucleus or of the trapezoid nucleus of the same or opposite side, while others, crossed or uncrossed, pass directly into the lateral lemniscus. If the further connections of the cochlear nerve of one side, say the left, be considered, it is found that they lie lateral to the main sensory tract, the lemniscus, and are therefore termed the lateral lemniscus. The fibres comprising the left lateral lemniscus arise in the superior olivary and trapezoid nuclei of the same or opposite side, while others are the uninterrupted fibres already alluded to, and these are either crossed or uncrossed, the former being the axons of the cells of the right accessory nucleus or of the cells of the right tuberculum acousticum, while the latter are derived from the cells of the left nuclei. In the upper part of the lateral lemniscus there is a collection of nerve cells, the nucleus of the lateral lemniscus, around the cells of which some of the fibres arborize, and from the cells of which axons originate to continue upward this tract of the lateral lemniscus. The ultimate ending of the left lateral lemniscus is partly in the opposite medial geniculate body and partly in the inferior colliculi. From the cells of these bodies new fibres arise and ascend in the occipital part of the internal capsule to reach the posterior 3/5 of the left superior temporal gyrus and the transverse temporal gyri. Vestibular nerve. The vestibular nerve or root, the nerve of equilibration, arises from bipolar cells in the vestibular ganglion, ganglion of Scarpa, which is situated in the upper part of the outer end of the internal auditory meatus. The peripheral fibres divide into three branches. The superior branch passes through the foramina in the area vestibularis superior, and ends in the utricle and in the ampullae of the superior and lateral semicircular ducts. The fibres of the inferior branch traverse the foramina in the area vestibularis inferior and end in the saccule. The posterior branch runs through the foramen singulare and supplies the ampulla of the posterior semicircular duct. 5I. The glossopharyngeal nerve. Nervus glossopharyngeus, 9th nerve. The glossopharyngeal nerve contains both motor and sensory fibres, and is distributed, as its name implies, to the tongue and pharynx. It is the nerve of ordinary sensation to the mucous membrane of the pharynx, fauces, and palatine tonsil, and the nerve of taste to the posterior part of the tongue. It is attached by 3 or 4 filaments to the upper part of the medulla oblongata in the groove between the olive and the inferior peduncle. The sensory fibres arise from the cells of the superior and petrous ganglia, which are situated on the trunk of the nerve and will be presently described. When traced into the medulla, some of the sensory fibres, probably sympathetic afferent, end by arborizing around the cells of the upper part of the nucleus, which lies between the ala cinerea in the lower part of the rhomboid fossa. Many of the fibres, probably the taste fibres, contribute to form a strand, named the fasciculus solitarius, which descends in the medulla oblongata. Associated with this strand are numerous nerve cells, and around these the fibres of the fasciculus end. The somatic sensory fibres, few in number, are said to join the spinal tract of the trigeminal nerve. The somatic motor fibres spring from the cells of the nucleus ambiguus, which lies some distance from the surface of the rhomboid fossa in the lateral part of the medulla, and is continuous below with the anterior grey column of the medulla spinalis. From this nucleus the fibres are first directed backward, and then they bend forward and lateralward to join the fibres of the sensory root. The nucleus ambiguus gives origin to the motor branches of the glossopharyngeal and vagus nerves, and to the cranial part of the accessory nerve. The sympathetic efferent fibres from the nucleus beneath the ala cinerea, the dorsal nucleus, are probably both preganglionic motor fibres and preganglionic secretory fibres of the sympathetic system. The secretory fibres pass to the otic ganglion, and from it secondary neurons are distributed to the parotid gland. Some authors describe these fibres as arising from a distinct nucleus, the inferior salivatory nucleus, which lies near the dorsal nucleus. From the medulla oblongata, the glossopharyngeal nerve passes lateralward across the flocculus and leaves the skull through the central part of the jugular foramen in a separate sheath of the dura mater, lateral to and in front of the vagus and accessory nerves. In its passage through the jugular foramen, it grooves the lower border of the petrous part of the temporal bone and, at its exit from the skull, passes forward between the internal jugular vein and internal carotid artery. It descends in front of the latter vessel, and beneath the styloid process and the muscles connected with it, to the lower border of the stylopharyngeus. It then curves forward, forming an arch on the side of the neck and lying upon the stylopharyngeus and constrictor pharyngeus medius. Thence it passes under cover of the hypoglossal, and is finally distributed to the palatine tonsil, the mucous membrane of the fauces and base of the tongue, and the mucous glands of the mouth. In passing through the jugular foramen, the nerve presents 2 ganglia, the superior and the petrous. The superior ganglion, ganglion superius, jugular ganglion, is situated in the upper part of the groove, in which the nerve is lodged during its passage through the jugular foramen. It is very small, and is usually regarded as a detached portion of the petrous ganglion. The petrous ganglion, ganglion petrosum, inferior ganglion, is larger than the superior, and is situated in a depression in the lower border of the petrous portion of the temporal bone. Branches of communication. The glossopharyngeal nerve communicates with the vagus, sympathetic, and facial. The branches to the vagus are 2 filaments which arise from the petrous ganglion, one passing to the auricular branch and the other to the jugular ganglion of the vagus. The petrous ganglion is connected by a filament with the superior cervical ganglion of the sympathetic. The branch of communication with the facial perforates the posterior belly of the digastricus. It arises from the trunk of the glossopharyngeal below the petrous ganglion, and joins the facial just after the exit of that nerve from the stylomastoid foramen. Branches of distribution. The branches of distribution of the glossopharyngeal are the tympanic, carotid, pharyngeal, muscular, tonsillar, and lingual. The tympanic nerve, nervus tympanicus, nerve of Jacobson, arises from the petrous ganglion, and ascends to the tympanic cavity through a small canal on the under surface of the petrous portion of the temporal bone on the ridge which separates the carotid canal from the jugular fossa. In the tympanic cavity it divides into branches which form the tympanic plexus and are contained in grooves upon the surface of the promontory. This plexus gives off 1. The lesser superficial petrosal nerve, 2. A branch to join the greater superficial petrosal nerve, and 3. Branches to the tympanic cavity, all of which will be described in connection with the anatomy of the middle ear. The carotid branches. Nervus carotico-tympanicus superior and nervus carotico-tympanicus inferior, descend along the trunk of the internal carotid artery as far as its origin, communicating with the pharyngeal branch of the vagus, and with the branches of the sympathetic. The pharyngeal branches, rami pharyngei, are 3 or 4 filaments which unite opposite the constrictor pharyngeus medius with the pharyngeal branches of the vagus and sympathetic to form the pharyngeal plexus. Branches from this plexus perforate the muscular coat of the pharynx and supply its muscles and mucous membrane. The muscular branch, ramus stylopharyngeus, is distributed to the stylopharyngeus. The tonsillar branches, rami tonsillaris, supply the palatine tonsil, forming around it a plexus from which filaments are distributed to the soft palatine fauces, where they communicate with the palatine nerves. The lingual branches, rami lingualis, are 2 in number. One supplies the papillae velatae and the mucous membrane covering the base of the tongue. The other supplies the mucous membrane and follicular glands of the posterior part of the tongue, and communicates with the lingual nerve. End of section number 31. Section 32 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. The vagus nerve. 5J, the vagus nerve. Nervus vagus, 10th nerve, pneumogastric nerve. The vagus nerve is composed of both motor and sensory fibres, and has a more extensive course and distribution than any of the other cranial nerves, since it passes through the neck and thorax to the abdomen. The vagus is attached by 8 or 10 filaments to the medulla oblongata, in the groove between the olive and the inferior peduncle, below the glossopharyngeal. The sensory fibres arise from the cells of the jugular ganglion and ganglion nodosum of the nerve, and, when traced into the medulla oblongata, mostly end by arborizing around the cells of the inferior part of a nucleus which lies beneath the ala cinerea in the lower part of the rhomboid fossa. These are the sympathetic afferent fibres. Some of the sensory fibres of the glossopharyngeal nerve have been seen to end in the upper part of this nucleus. A few of the sensory fibres of the vagus, probably taste fibres, descend in the fasciculus solitarius and end around its cells. The somatic sensory fibres, few in number, from the posterior part of the external auditory meatus and the back of the ear, probably join the spinal tract of the trigeminal as it descends in the medulla. The somatic motor fibres arise from the cells of the nucleus ambiguus, already referred to in connection with the motor root of the glossopharyngeal nerve. The sympathetic efferent fibres, distributed probably as preganglionic fibres to the thoracic and abdominal viscera, i.e. as motor fibres to the bronchial tree, inhibitory fibres to the heart, motor fibres to the esophagus, stomach, small intestine and gall passages, and as secretory fibres to the stomach and pancreas, arise from the dorsal nucleus of the vagus. The filaments of the nerve unite and form a flat cord, which passes beneath the flocculus to the jugular foramen, through which it leaves the cranium. In emerging through this opening, the vagus is accompanied by and contained in the same sheath of dura mater with the accessory nerve, a septum separating them from the glossopharyngeal which lies in front. In this situation the vagus presents a well-marked ganglionic enlargement, which is called the jugular ganglion, ganglion of the root. To it the accessory nerve is connected by 1 or 2 filaments. After its exit from the jugular foramen, the vagus is joined by the cranial portion of the accessory nerve, and enlarges into a second gangliform swelling called the ganglion nodosum, ganglion of the trunk. Through this the fibres of the cranial portion of the accessory pass without interruption, being principally distributed to the pharyngeal and superior laryngeal branches of the vagus. But some of its fibres descend in the trunk of the vagus, to be distributed with the recurrent nerve and probably also with the cardiac nerves. The vagus nerve passes vertically down the neck within the carotid sheath, lying between the internal jugular vein and internal carotid artery, as far as the upper border of the thyroid cartilage, and then between the same vein and the common carotid artery to the root of the neck. The further course of the nerve differs on the 2 sides of the body. On the right side, the nerve passes across the subclavian artery between it and the right innominate vein, and descends by the side of the trachea to the back of the root of the lung, where it spreads out in the posterior pulmonary plexus. From the lower part of this plexus two cords descend on the esophagus, and divide to form, with branches from the opposite nerve, the esophageal plexus. Below, these branches are collected into a single cord, which runs along the back of the esophagus, enters the abdomen, and is distributed to the postero-inferior surface of the stomach, joining the left side of the celiac plexus, and sending filaments to the lienal plexus. On the left side, the vagus enters the thorax between the left carotid and subclavian arteries, behind the innominate vein. It crosses the left side of the arch of the aorta, and descends behind the root of the left lung, forming there the posterior pulmonary plexus. From this it runs along the anterior surface of the esophagus, where it unites with the nerve of the right side in the esophageal plexus, and is continued to the stomach, distributing branches over its anterosuperior surface. Some of these extend over the fundus and others along the lesser curvature. Filaments from these branches enter the lesser omentum and join the hepatic plexus. The jugular ganglion, ganglion jugulare, ganglion of the root, is of a greyish colour, spherical in form, about 4 mm in diameter. Branches of communication. This ganglion is connected by several delicate filaments to the cranial portion of the accessory nerve. It also communicates by a twig with the petrous ganglion of the Glossopharyngeal, with the facial nerve by means of its auricular branch, and with the sympathetic by means of an ascending filament from the superior cervical ganglion. The ganglion nodosum, ganglion of the trunk, inferior ganglion, is cylindrical in form, of a reddish colour, and 2.5 cm in length. Passing through it is the cranial portion of the accessory nerve, which blends with the vagus below the ganglion. Branches of communication. This ganglion is connected with the hypoglossal, the superior cervical ganglion of the sympathetic, and the loop between the first and second cervical nerves. Branches of distribution. The branches of distribution of the vagus are: in the jugular fossa, meningeal, auricular; in the neck, pharyngeal, superior laryngeal, recurrent, superior cardiac; in the thorax, inferior cardiac, anterior bronchial, posterior bronchial, esophageal; in the abdomen, gastric, celiac, hepatic. The meningeal branch, ramus meningeus, dural branch, is a recurrent filament given off from the jugular ganglion. It is distributed to the dura mater in the posterior fossa of the base of the skull. The auricular branch, ramus auricularis, nerve of Arnold, arises from the jugular ganglion and is joined soon after its origin by a filament from the petrous ganglion of the Glossopharyngeal. It passes behind the internal jugular vein and enters the mastoid canaliculus on the lateral wall of the jugular fossa. Traversing the substance of the temporal bone, it crosses the facial canal about 4 mm above the stylomastoid foramen, and here it gives off an ascending branch which joins the facial nerve. The nerve reaches the surface by passing through the tympanomastoid fissure between the mastoid process and the tympanic part of the temporal bone, and divides into two branches. One joins the posterior auricular nerve, the other is distributed to the skin of the back of the auricula, and to the posterior part of the external acoustic meatus. The pharyngeal branch, ramus pharyngeus, the principal motor nerve of the pharynx, arises from the upper part of the ganglion nodosum, and consists principally of filaments from the cranial portion of the accessory nerve. It passes across the internal carotid artery to the upper border of the constrictor pharyngeus medius, where it divides into numerous filaments, which join with branches from the glossopharyngeal, sympathetic, and external laryngeal to form the pharyngeal plexus. From the plexus, branches are distributed to the muscles and mucous membrane of the pharynx and the muscles of the soft palate, except the tensor veli palatini. A minute filament descends and joins the hypoglossal nerve as it winds around the occipital artery. The superior laryngeal nerve, nervus laryngeus superior, larger than the preceding, arises from the middle of the ganglion nodosum, and in its course receives a branch from the superior cervical ganglion of the sympathetic. It descends by the side of the pharynx behind the internal carotid artery and divides into two branches, external and internal. The external branch, ramus externus, the smaller, descends on the larynx beneath the sternothyreoideus to supply the cricothyreoideus. It gives branches to the pharyngeal plexus and the constrictor pharyngis inferior, and communicates with the superior cardiac nerve behind the common carotid artery. The internal branch, ramus internus, descends to the hyothyroid membrane, pierces it in company with the superior laryngeal artery, and is distributed to the mucous membrane of the larynx. Of these branches some are distributed to the epiglottis, the base of the tongue, and the epiglottic glands. Others pass backward in the aryepiglottic fold to supply the mucous membrane surrounding the entrance of the larynx, and that lining the cavity of the larynx as low down as the vocal folds. A filament descends beneath the mucous membrane on the inner surface of the thyroid cartilage and joins the recurrent nerve. The recurrent nerve, nervus recurrens, inferior or recurrent laryngeal nerve, arises on the right side in front of the subclavian artery, winds from before backward around that vessel, and ascends obliquely to the side of the trachea behind the common carotid artery, and either in front of or behind the inferior thyroid artery. On the left side it arises on the left of the arch of the aorta, and winds below the aorta at the point where the ligamentum arteriosum is attached, and then ascends to the side of the trachea. The nerve on either side ascends in the groove between the trachea and the esophagus, passes under the lower border of the constrictor pharyngis inferior, and enters the larynx behind the articulation of the inferior cornu of the thyroid cartilage, with the cricoid. It is distributed to all the muscles of the larynx, excepting the cricothyreoideus. It communicates with the internal branch of the superior laryngeal nerve, and gives off a few filaments to the mucous membrane of the lower part of the larynx. As the recurrent nerve hooks around the subclavian artery or aorta, it gives off several cardiac filaments to the deep part of the cardiac plexus. As it ascends in the neck it gives off branches, more numerous on the left than on the right side, to the mucous membrane and muscular coat of the esophagus, branches to the mucous membrane and muscular fibres of the trachea, and some pharyngeal filaments to the constrictor pharyngis inferior. The superior cardiac branches, rami cardiaci superiores, cervical cardiac branches, 2 or 3 in number, arise from the vagus at the upper and lower parts of the neck. The upper branches are small, and communicate with the cardiac branches of the sympathetic. They can be traced to the deep part of the cardiac plexus. The lower branch arises at the root of the neck, just above the first rib. That from the right vagus passes in front of, or by the side of the innominate artery, and proceeds to the deep part of the cardiac plexus. That from the left runs down the left side of the arch of the aorta, and joins the superficial part of the cardiac plexus. The inferior cardiac branches, rami cardiaci inferiores, thoracic cardiac branches, on the right side, arise from the trunk of the vagus as it lies by the side of the trachea, and from its recurrent nerve. On the left side from the recurrent nerve only. Passing inward, they end in the deep part of the cardiac plexus. The anterior bronchial branches, rami bronchialis anteriores, anterior or ventral pulmonary branches, 2 or 3 in number, and of small size, are distributed on the anterior surface of the root of the lung. They join with filaments from the sympathetic, and form the anterior pulmonary plexus. The posterior bronchial branches, rami bronchialis posteriores, posterior or dorsal pulmonary branches, more numerous and larger than the anterior, are distributed on the posterior surface of the root of the lung. They are joined by filaments from the third and fourth, sometimes also from the first and second, thoracic ganglia of the sympathetic trunk, and form the posterior pulmonary plexus. Branches from this plexus accompany the ramifications of the bronchi through the substance of the lung. The esophageal branches, rami esophagei, are given off both above and below the bronchial branches. The lower are numerous and larger than the upper. They form, together with the branches from the opposite nerve, the esophageal plexus. From this plexus filaments are distributed to the back of the pericardium. The gastric branches, rami gastrici, are distributed to the stomach. The right vagus forms the posterior gastric plexus on the postero-inferior surface of the stomach, and the left the anterior gastric plexus on the antero-superior surface. The coeliac branches, rami coeliaci, are mainly derived from the right vagus. They join the coeliac plexus and through it supply branches to the pancreas, spleen, kidneys, suprarenal bodies, and intestine. The hepatic branches, rami hepatici, arise from the left vagus. They join the hepatic plexus and through it are conveyed to the liver. End of Part 32. Section 33 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information, or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 4, by Henry Gray. Accessory nerve, hypoglossal nerve. 5K, the accessory nerve. Nervus accessorius. 11th nerve, spinal accessory nerve. The accessory nerve consists of two parts, a cranial and a spinal. The cranial part, ramus internus, accessory portion, is the smaller of the two. Its fibres arise from the cells of the nucleus ambiguus and emerge as 4 or 5 delicate rootlets from the side of the medulla oblongata, below the roots of the vagus. It runs lateralward to the jugular foramen, where it interchanges fibres with the spinal portion, or becomes united to it for a short distance. Here it is also connected by 1 or 2 filaments with the jugular ganglion of the vagus. It then passes through the jugular foramen, separates from the spinal portion, and is continued over the surface of the ganglion nodosum of the vagus, to the surface of which it is adherent, and is distributed principally to the pharyngeal and superior laryngeal branches of the vagus. Through the pharyngeal branch it probably supplies the musculus uvulae and levator veli palatini. Some few filaments from it are continued into the trunk of the vagus below the ganglion, to be distributed with the recurrent nerve and probably also with the cardiac nerves. The spinal part, ramus externus, spinal portion, is firm in texture, and its fibres arise from the motor cells in the lateral part of the anterior column of the grey substance of the medulla spinalis, as low as the 5th cervical nerve. Passing through the lateral funiculus of the medulla spinalis, they emerge on its surface and unite to form a single trunk, which ascends between the ligamentum denticulatum and the posterior roots of the spinal nerves, enters the skull through the foramen magnum, and is then directed to the jugular foramen, through which it passes, lying in the same sheath of dura mater as the vagus, but separated from it by a fold of the arachnoid. In the jugular foramen it receives 1 or 2 filaments from the cranial part of the nerve, or else joins it for a short distance and then separates from it again. At its exit from the jugular foramen, it runs backward in front of the internal jugular vein in 66.6% of cases, and behind it in 33.3%. Tandler. The nerve then descends obliquely behind the digastricus and stylohyoideus to the upper part of the sternocleidomastoideus. It pierces this muscle and courses obliquely across the posterior triangle of the neck to end in the deep surface of the trapezius. As it traverses the sternocleidomastoideus, it gives several filaments to the muscle, and joins with branches from the 2nd cervical nerve. In the posterior triangle it unites with the 2nd and 3rd cervical nerve, while beneath the trapezius it forms a plexus with the 3rd and 4th cervical nerves, and from this plexus fibres are distributed to the muscle. 5L. The hypoglossal nerve. Nervus hypoglossus, 12th nerve. The hypoglossal nerve is the motor nerve of the tongue. Its fibres arise from the cells of the hypoglossal nucleus, which is an upward prolongation of the base of the anterior column of grey substance of the medulla spinalis. This nucleus is about 2 cm in length, and its upper part corresponds with the trigonum hypoglossae, or lower portion of the medial eminence of the rhomboid fossa. The lower part of the nucleus extends downward into the closed part of the medulla oblongata, and there lies in relation to the ventrolateral aspect of the central canal. The fibres run forward through the medulla oblongata and emerge in the anterolateral sulcus between the pyramid and the olive. The rootlets of this nerve are collected into two bundles, which perforate the dura mater separately, opposite the hypoglossal canal in the occipital bone, and unite together after their passage through it. In some cases the canal is divided into two by a small bony spicule. The nerve descends almost vertically to a point corresponding with the angle of the mandible. It is at first deeply seated beneath the internal carotid artery and internal jugular vein, and intimately connected with the vagus nerve. It then passes forward between the vein and artery, and lower down in the neck becomes superficial below the digastricus. The nerve then loops around the occipital artery, and crosses the external carotid and lingual arteries below the tendon of the digastricus. It passes beneath the tendon of the digastricus, the stylohyoideus, and the mylohyoideus, lying between the last named muscle and the hyoglossus, and communicates at the anterior border of the hyoglossus with the lingual nerve. It is then continued forward in the fibres of the genioglossus as far as the tip of the tongue, distributing branches to its muscular substance. Branches of communication. Its branches of communication are with the vagus, first and second cervical nerves, sympathetic, lingual. The communications with the vagus take place close to the skull, numerous filaments passing between the hypoglossal and the ganglion nodosum of the vagus through the mass of connective tissue which unites the two nerves. As the nerve winds round the occipital artery, it gives off a filament to the pharyngeal plexus. The communication with the sympathetic takes place opposite the atlas by branches derived from the superior cervical ganglion, and in the same situation the nerve is joined by a filament derived from the loop connecting the first and second cervical nerves. The communications with the lingual take place near the anterior border of the hyoglossus by numerous filaments which extend upon the muscle. Branches of distribution. The branches of distribution of the hypoglossal nerve are meningeal, thyrohyoid, descending, muscular. Of these branches, the meningeal, descending, thyrohyoid, and the muscular twig to the geniohyoideus are probably derived mainly from the branch which passes from the loop between the first and second cervical to join the hypoglossal. Meningeal branches, dural branches. As the hypoglossal nerve passes through the hypoglossal canal, it gives off, according to Luschka, several filaments to the dura mater in the posterior fossa of the skull. The descending ramus, ramus descendens, descendens hypoglossae, long and slender, quits the hypoglossal where it turns around the occipital artery and descends in front of, or in the sheath of, the carotid vessels. It gives a branch to the superior belly of the omohyoideus, and then joins the communicantes cervicalis from the second and third cervical nerves, just below the middle of the neck, to form a loop, the ansa hypoglossae. From the convexity of this loop, branches pass to supply the sternohyoideus, the sternothyreoideus, and the inferior belly of the omohyoideus. According to Arnold, another filament descends in front of the vessels into the thorax and joins the cardiac and phrenic nerves. The thyrohyoid branch, ramus thyrohyoideus, arises from the hypoglossal near the posterior border of the hyoglossus. It runs obliquely across the greater conure of the hyoid bone and supplies the thyrohyoideus muscle. The muscular branches are distributed to the styloglossus, hyoglossus, geniohyoideus, and genioglossus. At the undersurface of the tongue, numerous slender branches pass upward into the substance of the organ to supply its intrinsic muscles. End of Part 33.
Of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 4, by Henry Gray. The spinal nerves. Nervi spinalis. The spinal nerves spring from the medulla spinalis and are transmitted through the intervertebral foramina. They number 31 pairs, which are grouped as follows: cervical 8, thoracic 12, lumbar 5, sacral 5, coccygeal 1. The first cervical nerve emerges from the vertebral canal between the occipital bone and the atlas, and is therefore called the suboccipital nerve. The eighth issues between the seventh cervical and first thoracic vertebrae. Nerve roots. Each nerve is attached to the medulla spinalis by two roots, an anterior or ventral, and a posterior or dorsal, the latter being characterized by the presence of a ganglion, the spinal ganglion. The anterior root, radix anterior, ventral root, emerges from the anterior surface of the medulla spinalis as a number of rootlets or filaments, phyla radicularia, which coalesce to form two bundles near the intervertebral foramen. The posterior root, radix posterior, dorsal root, is larger than the anterior owing to the greater size and number of its rootlets. These are attached along the posterior lateral furrow of the medulla spinalis and unite to form two bundles which join the spinal ganglion. The posterior root of the first cervical nerve is exceptional in that it is smaller than the anterior. It is occasionally wanting. The spinal ganglia, ganglion spinale, are connections of nerve cells on the posterior roots of the spinal nerves. Each ganglion is oval in shape, reddish in color, and its size bears a proportion to that of the nerve root on which it is situated. It is bifid medially, where it is joined by the two bundles of the posterior nerve root. The ganglia are usually placed in the intervertebral foramina, immediately outside the points where the nerve roots perforate the dura mater, but there are exceptions to this rule. Thus the ganglia of the first and second cervical nerves lie on the vertebral arches of the atlas and axis, respectively. Those of the sacral nerves are inside the vertebral canal, while that on the posterior root of the coccygeal nerve is placed within the sheath of the dura mater. Structure. The ganglia consist chiefly of unipolar nerve cells, and from these the fibers of the posterior root take origin, the single process of each cell dividing after a short course into a central fiber which enters the medulla spinalis and a peripheral fiber which runs into the spinal nerve. Two other forms of cells are, however, present, namely, a. the cells of Doggiel, whose axons ramify close to the cell, type 2 of Golgi, and are distributed entirely within the ganglion, and b. multipolar cells similar to those found in the sympathetic ganglia. The ganglia of the first cervical nerve may be absent, while small aberrant ganglia consisting of groups of nerve cells are sometimes found on the posterior roots between the spinal ganglia and the medulla spinalis. Each nerve root receives a covering from the pia mater and is loosely invested by the arachnoid, the latter being prolonged as far as the points where the roots pierce the dura mater. The two roots pierce the dura mater separately, each receiving a sheath from this membrane, where the roots join to form the spinal nerve. This sheath is continuous with the epineurium of the nerve. Size and direction. The roots of the upper four cervical nerves are small. Those of the lower four are large. The posterior roots of the cervical nerves bear a proportion to the anterior of 3:1, which is greater than in the other regions. Their individual filaments are also larger than those of the anterior roots. The posterior root of the first cervical is an exception to this rule, being smaller than the anterior root. In 8% of cases it is wanting. The roots of the first and second cervical nerves are short, and run nearly horizontally to their points of exit from the vertebral canal. From the second to the eighth cervical they are directed obliquely downward, the obliquity and length of the roots successively increasing. The distance, however, between the level of attachment of any of these roots to the medulla spinalis and the points of exit of the corresponding nerves never exceeds the depth of one vertebra. The roots of the thoracic nerves, with the exception of the first, are of small size, and the posterior only slightly exceed the anterior in thickness. They increase successively in length, from above downward, and in the lower part of the thoracic region descend in contact with the medulla spinalis for a distance equal to the height of at least 2 vertebrae before they emerge from the vertebral canal. The roots of the lower lumbar and upper sacral nerves are the largest, and their individual filaments the most numerous of all the spinal nerves, while the roots of the coccygeal nerve are the smallest. The roots of the lumbar, sacral, and coccygeal nerves run vertically downward to their respective exits, and as the medulla spinalis ends near the lower border of the first lumbar vertebra, it follows that the length of the successive roots must rapidly increase. As already mentioned, the term cauda equina is applied to this collection of nerve roots. From the description given it will be seen that the largest nerve roots, and consequently the largest spinal nerves, are attached to the cervical and lumbar swellings of the medulla spinalis. These nerves are distributed to the upper and lower limbs. Connections with the sympathetic. Immediately beyond the spinal ganglion, the anterior and posterior nerve roots unite to form the spinal nerve, which emerges through the intervertebral foramen. Each spinal nerve receives a branch, gray ramus communicans, from the adjacent ganglion of the sympathetic trunk, while the thoracic and the first and second lumbar nerves each contribute a branch, white ramus communicans, to the adjoining sympathetic ganglion. The second, third, and fourth sacral nerves also supply white rami. These, however, are not connected with the ganglia of the sympathetic trunk, but run directly into the pelvic plexuses of the sympathetic. Structure. Each typical spinal nerve contains fibers belonging to two systems, namely the somatic and the sympathetic or splanchnic, as well as fibers connecting these systems with each other. 1. The somatic fibers are efferent and afferent. The efferent fibers originate in the cells of the anterior column of the medulla spinalis and run outward through the anterior nerve roots to the spinal nerve. They convey impulses to the voluntary muscles and are continuous from their origin to their peripheral distribution. The afferent fibers convey impressions inward from the skin, etc., and originate in the unipolar nerve cells of the spinal ganglia. The single processes of these cells divide into peripheral and central fibers, and the latter enter the medulla spinalis through the posterior nerve roots. 2. The sympathetic fibers are also efferent and afferent. The efferent fibers, preganglionic fibers, originate in the lateral column of the medulla spinalis and are conveyed through the anterior nerve root in the white ramus communicans to the corresponding ganglion of the sympathetic trunk. Here they may end by forming synapses around its cells, or may run through the ganglion to end in another of the ganglia of the sympathetic trunk, or in a more distally placed ganglion in one of the sympathetic plexuses. In all cases they end by forming synapses around other nerve cells. From the cells of the ganglia of the sympathetic trunk, other fibers, postganglionic fibers, take origin. Some of these run through the gray rami communicantes to join the spinal nerves, along which they are carried to the blood vessels of the trunk and the limbs, while others pass to the viscera, either directly or after interruption in one of the distal ganglia. The afferent fibers are derived partly from the unipolar cells and partly from the multipolar cells of the spinal ganglia. Their peripheral processes are carried through the white rami communicantes, and after passing through one or more sympathetic ganglia, but always without interruption in them, finally end in the tissues of the viscera. The central processes of the unipolar cells enter the medulla spinalis through the posterior nerve root and form synapses around either somatic or sympathetic efferent neurons, thus completing reflex arcs. The dendrites of the multipolar nerve cells form synapses around the cells of type 2, cells of Dogiel, in the spinal ganglia, and by this path the original impulse is transferred from the sympathetic to the somatic system, through which it is conveyed to the sensorium. Divisions. After emerging from the intervertebral foramen, each spinal nerve gives off a small meningeal branch, which re-enters the vertebral canal through the intervertebral foramen and supplies the vertebrae and their ligaments, and the blood vessels of the medulla spinalis and its membranes. The spinal nerve then splits into a posterior or dorsal and an anterior or ventral division, each receiving fibers from both nerve roots. End of section 34.
Section 35 of Gray's Anatomy, Part 4. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Leanne Howlett. Anatomy of the Human Body, Part 4 by Henry Gray. Posterior Divisions. 6a. The posterior divisions. Rami posterioris. The posterior divisions are as a rule smaller than the anterior. They are directed backward, and with the exceptions of those of the first cervical, the fourth and fifth sacral, and the coccygeal, divide into medial and lateral branches for the supply of the muscles and skin of the posterior part of the trunk. The cervical nerves, nervi cervicalis. The posterior division of the first cervical or sub-occipital nerve is larger than the anterior division and emerges above the posterior arch of the atlas and beneath the vertebral artery. It enters the suboccipital triangle and supplies the muscles which bound this triangle, viz., the rectus capitis posterior major and the obliqui superior and inferior. It gives branches also to the rectus capitis posterior minor and the semispinalis capitis. A filament from the branch to the obliquus inferior joins the posterior division of the second cervical nerve. The nerve occasionally gives off a cutaneous branch, which accompanies the occipital artery to the scalp and communicates with the greater and lesser occipital nerves. The posterior division of the second cervical nerve is much larger than the anterior division, and is the greatest of all the cervical posterior divisions. It emerges between the posterior arch of the atlas and the lamina of the axis, below the obliquus inferior. It supplies a twig to this muscle, receives a communicating filament from the posterior division of the first cervical, and then divides into a large medial and a small lateral branch. The medial branch, ramus medialis, internal branch, called from its size and distribution the greater occipital nerve, nervus occipitalis major, great occipital nerve, ascends obliquely between the obliquus inferior and the semispinalis capitis, and pierces the latter muscle and the trapezius near their attachments to the occipital bone. It is then joined by a filament from the medial branch of the posterior division of the third cervical, and, ascending on the back of the head with the occipital artery, divides into branches which communicate with the lesser occipital nerve and supply the skin of the scalp as far forward as the vertex of the skull. It gives off muscular branches to the semispinalis capitis, and occasionally a twig to the back of the auricula. The lateral branch, ramus lateralis, external branch, supplies filaments to the splenius, longus capitis, and semispinalis capitis, and is often joined by the corresponding branch of the third cervical. The posterior division of the third cervical is intermediate in size between those of the second and fourth. Its medial branch runs between the semispinalis capitis and cervices, and piercing the splenius and trapezius, ends in the skin. While under the trapezius it gives off a branch called the third occipital nerve, which pierces the trapezius and ends in the skin of the lower part of the back of the head. It lies medial to the greater occipital and communicates with it. The lateral branch often joins that of the second cervical. The posterior division of the suboccipital and the medial branches of the posterior division of the second and third cervical nerves are sometimes joined by communicating loops to form the posterior cervical plexus, Cruveilhier. The posterior divisions of the lower 5 cervical nerves divide into medial and lateral branches. The medial branches of the fourth and fifth run between the semispinalis cervices and capitis, and having reached the spinous processes, pierce the splenius and trapezius to end in the skin. Sometimes the branch of the fifth fails to reach the skin. Those of the lower 3 nerves are small, and end in the semispinalis cervicis and capitis, multifidus and interspinales. The lateral branches of the lower 5 nerves supply the iliocostalis cervicus, longissimus cervicis, and longissimus capitis. The thoracic nerves, nervi thoracalis. The medial branches, ramus medialis, internal branch, of the posterior divisions of the upper 6 thoracic nerves run between the semispinalis dorsi and multifidus, which they supply. They then pierce the rhomboidii and trapezius, and reach the skin by the sides of the spinous processes. The medial branches of the lower 6 are distributed chiefly to the multifidus and longissimus dorsi. Occasionally they give off filaments to the skin near the middle line. The lateral branches, ramus lateralis, external branch, increase in size from above downward. They run through or beneath the longissimus dorsi to the interval between it and the iliocostalas, and supply these muscles. The lower 5 or 6 also give off cutaneous branches which pierce the serratus posterior inferior and latimus dorsi and align with the angles of the ribs. The lateral branches of a variable number of the upper thoracic nerves also give filaments to the skin. The lateral branch of the 12th thoracic, after sending a filament medialward along the iliac crest, passes downward to the skin of the buttock. The medial cutaneous branches of the posterior divisions of the thoracic nerves descend for some distance close to the spinous processes before reaching the skin, while the lateral branches travel downward for a considerable distance, it may be as much as the breadth of 4 ribs, before they become superficial. The branch from the 12th thoracic, for instance, reaches the skin only a little way above the iliac crest. The lumbar nerves, nervi lumbalis. The medial branches of the posterior divisions of the lumbar nerves run close to the articular processes of the vertebrae and end in the multifidus. The lateral branches supply the sacrospinalis. The upper 3 give off cutaneous nerves which pierce the aponeurosis of the latissimus dorsi at the lateral border of the sacrospinalis and descend across the posterior part of the iliac crest to the skin of the buttock, some of their twigs running as far as the level of the greater trochanter. The sacral nerves, nervi sacralis. The posterior divisions of the sacral nerves, rami posterioris, are small, and diminish in size from above downward. They emerge, except the last, through the posterior sacral foramina. The upper 3 are covered at their points of exit by the multifidus, and divide into medial and lateral branches. The medial branches are small, and end in the multifidus. The lateral branches join with one another and with the lateral branches of the posterior divisions of the last lumbar and 4th sacral to form loops on the dorsal surface of the sacrum. From these loops branches run to the dorsal surface of the sacrotuberous ligament, and form a second series of loops under the gluteus maximus. From this second series cutaneous branches, 2 or 3 in number, pierce the gluteus maximus along a line drawn from the posterior superior iliac spine to the tip of the coccyx. They supply the skin over the posterior part of the buttock. The posterior divisions of the lower 2 sacral nerves are small and lie below the multifidus. They do not divide into medial and lateral branches, but unite with each other and with the posterior division of the coccygeal nerve to form loops on the back of the sacrum. Filaments from these loops supply the skin over the coccyx. The coccygeal nerve, nervus coccygeus. The posterior division of the coccygeal nerve, ramus posterior, does not divide into a medial and a lateral branch, but receives, as already stated, a communicating branch from the last sacral. It is distributed to the skin over the back of the coccyx. End of section 35. Recording by Leanne Howlett.